Lagos, and welcome to ILERA EKO Extra. As the Greek physician Hippocrates once said, health is wealth. Join us today as we explore the Lagos State government's initiative via the Lagos State Health Management Agency to ensure that quality healthcare is accessible to all, regardless of wealth or status. Stay tuned this morning for an insightful discussion and expert advice, of course, on the Lagos State Health Insurance Scheme that we all know as ILERA EKO. Welcome one more time to ILERA EKO Extra right here on Lagos Traffic Radio 96.1 FM. My name is Akan Usen and we're live on air. Of course, this show will also be streaming live on Facebook, Lagos Traffic Radio 96.1 FM, and that's our page. And of course, you can also watch this on YouTube, Traffic Radio 961. So if that is your medium of choice, you can also join us. But please, if you're driving, that's a no. Yes, we advocate that nothing distracts you while you're driving. Of course, as the show progresses, definitely be giving you traffic feeds to keep you abreast of the traffic situation, so you can make informed decisions even as you navigate in and around the ever bustling Lagos metropolis. All right, we have a guest on the show who will of course be helping us shed light on the very interesting topic that we have on the front burner today. Yes, we're talking ILERA EKO standard JARA and V-Boot and all the telemedicine service. That's what we're going to be talking about today. We already started that discussion last week, and we'll be taking it to the next level. We'll have a guest with us on the show. He is Dr. Abiodun Atunrashe, Digital Health Manager, Lashma. You're welcome.
Thank you very much.
It's so great to have you on the show, and I guess this is your very first time. Is that correct? Okay, great to have you join us and take time out of your busy schedule. Okay, so straight away, before that, I'd want to know how's traffic coming in. I hope it wasn't so much of a bother.
No, it wasn't. It was quite a smooth road.
Quite smooth. Okay, great. So a few weeks back, the Lagos State Governor, Mr. Babajide Sanwo-Olu, launched the standard JARA Health Insurance Plan. And, of course, we spoke about this here. We know he commissioned 5 virtual booths. And, of course, the standard JARA plan and the V-Boots. We're told, okay, the ILERA EKO telemedicine service will now be part of this. So could you just give us a bit of an overview? What's the idea behind the telemedicine service, and who are those enrollees that can have access to this service?
Okay, so I called the commissioning that Mr. Governor did on the 16th of July the game changer. True. Healthcare insurance system. Because now with the V-Boot services, we're democratizing access to healthcare. We're spreading access to healthcare to the informal sector, to persons and businesses that would not necessarily have to leave where they are, their shops and locations, to where they can now get healthcare.
More or less, you are bringing it to where they are.
Grassroots.
They don't even need to
they don't need to
stress themselves to move so far.
So we're increasing access, increasing proximity, and also increasing affordability with this service. So the story behind the V-Boots started from 2020. As we all know, COVID was a changer in our lives. The pandemic,
a serious disruption
in the normal activities. It showed us and shared insights with us on how we could do things differently. It became the new normal. So with the advent of COVID, the Lagos State government in August 2020 launched the EKO Telemed initiative to be able to address emergencies of non-primary care based via teleconsultations, via health hotlines that were toll-free. So this now graduated into having it became the backbone of COVID follow-ups. It became the backbone of people that had been treated for COVID and follow-ups and everything. So progressing from that, we now decided to move the telemedicine service, and with the success that we recorded with patient follow-up and remote monitoring of patients, we decided to offer telemedicine services to our public servants. So that was in 2021. It became part of the ILERA EKO offerings for civil servants, and we built up on that with the partnership with with the private sector, and we moved the telemedicine service to porter cabins that were situated in University of Lagos. So we started with the University of Lagos sometime in 2022, 2023, and we had two of these booths that became prototypes that we have in the markets now. Two of these booths in the Unilag main campus then, and one at the Unilag medical campus.
Oh, so prior to this time, that was like a beta phase, sort of, like a testing phase?
Yes, it was a testing phase.
Okay.
Yeah, so it was a testing phase.
Okay.
So we recorded, year in, year out, we recorded successes with this. Patient satisfaction increased, improved overall outcomes.
Okay.
There was more adherence for patients to visit and, follow up. And there was, we were depopulizing the traditional hospitals, the brick-and-mortar hospitals. They were having more time to attend to, more emergencies, acute emergencies than patients that would just come in and have, minor complaints and everything. So that helped us.
That could as well have been handled by...
Yes, at the booths, at that level.
Yes.
So that was the whole story. So then we said, okay, this is good, this works, and we've tested it and it works. It's out of the 100% population of the students of University of Lagos, we had a 90% utilization rate.
Oh wow! Okay.
90%. So we built upon the success. I said, okay, let's move to the public now. We've done for civil servants. We've tested with the tertiary students. Now we move to the public, which formed the conception of the virtual booths that we have in the informal sector, situated at markets across the cities in Lagos. So that's the story with the telemedicine service.
Oh, great. A quick detour. We have this update of a broken down tipper at Agric in Kenny. We spoke about that earlier. Well, I can tell you it's now off the road, and a semblance of normalcy, normalcy of movement has been restored on that stretch. So if you're headed in that direction, you have nothing to worry about. All is back to normal. And the stretch of Ogunosi, all good to go. Mole connecting Agidingi, that the Ojudibaja axis, good as well. Excellence to connect Yaya Baton, good to go. Caterpillar Odoeron, looking very good. And I understand we have policemen positioned all around Berja, okay, both inwards and outwards. No impediment, and the traffic managers very much on ground doing their bit to, make sure things move as smoothly as possible on that stretch. Yes, it's ILERA EKO Extra right here on Lagos Traffic Radio 96.1 FM, and we have with us Dr. Abiodun Aturashe, Digital Health Manager, Lagos State Health Management Agency, LASHMA, and he has been helping us, shed light on the telemedicine service. Yes, part of the V-Boot, ILERA EKO Standard JARA, and he's been doing a great job of it. So, Doctor, tell us how this service will work. How will it run? So the telemedicine service under the Standard JARA and that of the V-Boot, how will it work?
Okay, so great. The Standard JARA, like every institution, we have reforms. We usually before now we had the standard plan.
Standard plan?
Yeah, so the standard plan, now we've graduated to the Standard JARA plan. Like the word JARA connotes in Yoruba, it means extra.
Yes.
Now we have extra services. We have extra access to consultation specialist services. Then we also have extra access to dialysis, mammogram, physiotherapy sessions. We're not on the standard plan. So we expanded our scope of access. And we needed to do this so as to ensure stakeholder win-win. And even for the enrollees, we had some enrollees that would say, oh, I've paid so and so amount, I'm not using this, they're just deducting from
why are
they paying. Now the Standard JARA component gives you access to annual medicine checkup and everything. So whether you are healthy,
like in the seniors, for the seniors plan,
both for the seniors and both for individuals, so there's an annual medicine checkup, so you can do that. So now another component of the Standard JARA was now when we incorporated the telemedicine service. Now some people will be asking, what's telemedicine?
Yeah.
So it's basically the ability to see a doctor remotely. That's telemedicine, seeing a doctor remotely via digital tools. What are the
let's break it down for the purposes of those who, might not. Yes, sir. So remotely, yes.
Yeah, remotely. When we say remote, it's not having a physical consultation with a doctor. So it doesn't dampen the experience either. But it's just that you and the doctor are not sharing the same physical space.
So you can be here and your doctor can be somewhere
in Canada. Your
and
doctor
you'll be
can
telling
be
okay, doctor, this
in
is
Badagry, in Ekpe.
Okay.
Yes, and everything. So So it's the ability to see a doctor remotely, not sharing the same physical space with the doctor. So the telemedicine service, like I said, the story was we had success stories. So we said, now let's put this part of our standard JARA component and, integrate telemedicine. Now, the telemedicine service is available for our standard JARA ILERA EKO release, which is now the basic plan, social health insurance plan.
Standard JARA.
The standard JARA is now
Okay, so what happens to the standard plus for those on standard plus, standard plan and all that?
So we're advocating for our release to, upgrade to our new plan. They are still existing, but they're upgrading to our new standard JARA plan. So standard JARA plan moving forward will be our baseline plan.
Okay, that will be the basic.
Yes, the basic plan.
Okay, so we had a bone of contention last week. I pray you'll be able to. Okay, so there are people already on the standard plan, who are thinking of upgrading. So will that be possible immediately, or how will that happen?
We're rolling out measures.
Okay.
To help
to address this.
Yes,
Great. Okay, we'll go for a quick breather. We'll take one or two announcements, and then when we come back, we'll take it to the next level, because I know a few people want to know about those not making use of the V-boots, and maybe due to the fact that they are far, if they can still, use the telemedicine service. Let's just quickly go for that break, and we'll be right back. Stay close.
You don't hear say Lashma don't bring V-boots come with market.
Now who be Lashma?
Lashma na Lagos State Health Management Agency. The people will bring ILERA EKO.
Oh, okay. The social health insurance people. But what you come consign us with V-boots?
Caro. V-boots na the online store where subscribers fit get telephone healthcare talk with Dokita. Them don't station all these V-boot stores them for all the big area markets throughout Lagos. People we don't already pay down for the standard JARA plan go enjoy all the better benefits of the old standard plan together with the new extra jolliment.
Abeg, tell me say this talk na true.
Just dial *6700 *006 # to join standard JARA one time, or call 0700 ILERA EKO. You fit also send WhatsApp message to 0704 535 8275 or register online for www.lashma.com. ILERA EKO, nobody go carry last.
ILERA EKO, la one leg.
My name na Johnny, but you fit to call me Standard Johnny. Yes, so that na because I don't register for the new ILERA EKO Standard JARA plan. Standard JARA na the advanced improvement level of the standard plan. So therefore, Standard JARA don't add extra JARA benefits, telephone medicine care, every year test or screening, plus different mental health service. You never finish, people we don't already pay down for the Standard JARA fit carry waka enter any of the new V-boot centers throughout all the big area market for Lagos. You know what is sweet paper? Your age or any past condition, no matter at all.
Oh yeah, begin receive more treatment for your health insurance with standard JARA. For more tori, make you WhatsApp or call 0700 ILERA EKO 07004 537 2356. You fit also register for any Ibile divisional office or ILERA EKO kiosk where they near you. ILERA EKO, nobody go carry last.
ILERA EKO, lo jẹ and logo.
Welcome back. It's ILERA EKO Extra right here on Lagos Traffic Radio 96.1 FM from our live camera feeds, our big screens right here in the studio. I can tell you traffic is looking really friendly. The early morning influx has, reduced. It's not as busy as it was earlier. It's now a better movement in and around the Lagos metropolis from what I can see right here. But from traffic light alternation here and there, I have a view of the Allen intersection where it's looking really good, apart from traffic light stoppages here and there. Looking at movement inwards the Iyanoworo and Lagos-Ibadan Expressway, precisely somewhere around the Alausa pedestrian bridge, the Maryland intersection for those trying to connect Odoyalaro end, and even the contraflow points. That's where we have road rehabilitation on Odoyalaro Bridge, looking good. Just a bit of a steady movement as you approach where the contraflow, the way you switch to the other side of the road. But from what I can see right here, looking at it, taking a closer look, for those coming in from the Ojota end, trying to connect Maryland, you might experience a bit of a slow movement as you approach that contraflow point. So that's the state of things on that end. By and large, we'll give you feeds to let you know how things change. We know traffic is dynamic, but trust that would always keep you updated. Yes, indeed, we have Dr. Abiodun Aturashe, who has been doing a great job of, shedding light on this important subject of the telemedicine service standard JARA plan, which is the newest offering of Lagos State Health Management Agency, and of course the virtual booths, 5 virtual booths. And a few people who didn't join us last week, I know they will be curious as to where the locations of these virtual booths are. But there is a pertinent question. Now, we know, Doctor, the telemedicine plan at some point in time prior to this new upgrade, it was a standalone plan, and it was also an add-on for, like you gave us like you told us prior to this time. So what is going to happen to the standalone telemedicine plan? Will it be phased out, or is it going to still be a standalone plan?
Okay, like I said earlier,
yes.
The standard JARA
yes.
is our new basic minimum insurance plan.
Okay.
So we'll be phasing out the telemedicine plan as a standalone plan.
All right.
Because the standard JARA offers the telemedicine benefits. Yes.
Okay, great. Okay, so how about the diaspora plan? Because I know telemedicine was also part of that. What happens to that?
So yes, that would still continue.
That will still continue, with the telemedicine.
Yes.
Okay. So now, for those on the standard JARA plan, who perhaps because now, so let's just touch on the locations of the V booths.
Okay. So we have in 5 locations.
5 locations. Okay.
The target is to go to 300.
300.
Yes,
wow.
300
Interesting.
Time. So our 5 starter locations we have in K2.
K2. Okay.
At K2 bus stop, you'll see our virtual booths there.
Okay.
We also have situated in Sabo Yaba Market.
Sabo Yaba Market. Okay. That's for the Yaba people.
Yes, for Yaba. Then we also have it at Sabo Ikorodu Market, within the market.
Okay.
Adamo Market as well.
All right.
And last but not the least, Ayetoro Market.
Ayetoro Market. That's 4.
Yes, Ayetoro Market in Ekwe.
Okay, that's 4.
No, K2.
K2.
At the K2 Market.
Sabo Yaba.
Sabo Ikorodu Market. Adamo Market.
Adamo
Ikorodu.
Then Ayetoro.
No, Adamo Ikorodu Market.
Okay.
Yes, then Ayetoro Market in
Ekwe. So that's 5. Now 5.
Yes, 5.
You didn't mention the Adamo before. So Adamo is still Ikorodu. Yes. Okay, so some people say, why is there a bias? We have 2 for Ikorodu. What happens to the other people, But speaking of, serving the market, there was a question that popped up last week about the fact that we have a big population. When you gave K2, how about those in the Mile 12? The Mile 12 end, Mile 12 has a really big market. If there are plans, to have a V booth there to, to serve the market women around that end. So,
like you said,
yes.
Like I said earlier, with every program,
yes,
there's plans to roll out. Our target number is 300.
300.
So I'll just tell our consumers, our enrollees, to look out for a V booth near them soon.
Okay.
Yeah.
Great. So moving on. So for those on the standard JARA or who are about to, hop on the standard JARA plan, but perhaps might not be making use of the V boot, maybe due to location and all that. How do they access this telemedicine service?
Yeah, wonderful question. So the telemedicine component is 3 phases.
Okay.
We have the health hotlines.
Health hotlines.
Yes,
okay.
The health hotlines, which I told you was built from the Eco Telemed initially. Now we've transformed it to ILERA EKO VBT.
Okay.
So that's 08000. 80,000.
80,000.
80,000.
80,000.
Yes,
okay, that's 4 zeros.
Yes, 4 zeros.
Okay.
EKO VBT.
Okay.
So that's the health hotline. So with this health hotline, you can speak to a doctor when you dial. You have the options.
So can we? Okay, we have a call. Let's just take this.
Okay.
Hello. Good morning. Hello. Good morning.
Yeah, good morning, sir. This is Mr. Yusuf Olamile Kadedeon from
Mr. Yusuf. Great to have you on the show. Good morning.
Yeah, good morning, doctor.
Good morning, Mr. Yusuf.
I can see that in all the V-boot centers you've mentioned, you didn't include our area, Ojoko LCD, Ifakojayi. Are there plans in future to extend it to other areas of Lagos State? That's my question. Thank you, sir.
All right. right. Thank you very much for your question. Doctor, would you want to respond to that?
Yes, Mr. Yusuf, I'll take your suggestions back to the office.
I think you have already.
Like I said,
Yes.
the plan is to spread out across the
This is sort of a
Lagos.
pilot phase.
Yes, it's a pilot phase.
All right. Okay. So 080-991-20777 and 091-538-77127. For those who want to reach out or ask questions, 091-538-77127 and 080-991-20777. Doctor, you were talking about the hotlines they can reach. So ECO VBT, what are the numbers for that? Let's come
over 80,000.
80,000.
ECO VBT.
Yeah, the
that would
digits,
be 356.
356.
For ECO.
Yeah.
Then 828.
828. That's for the VBT.
VBT, yeah, VBT.
VBT. Okay, 356 828. So for those who are trying to write it out, it's 08. Then after 08, then 0000. That's 4 zeros.
Yes.
So all you say 080. Oh, 080,000. Oh, how do I put that? Okay, 080,000. 080,000. Because 4 zeros after the 8. Then 356 828. Or if you like, ECO VBT. Okay, moving ahead. Yeah.
So that's our health hotline.
Okay.
Then we have the other phase is the mobile application.
Mobile application.
Yes.
Okay.
So we can download our ILERA EKO telemed application, available on Android or iOS. Android OS at the moment. But there's plan in place to get to the iOS store.
iOS, okay.
Yes,
okay, so now it's available on the Play Store.
Yes, it's available on the Google Play Store.
Okay.
So the ILERA EKO telemed app.
ILERA EKO telemed app. Okay, it's a standalone app.
Yeah, yes.
Okay. And
then last but not the least is now the virtual booths.
Virtual booth, okay.
Yes.
Which of course
the virtual booths, which is currently situated in the 5 access market access now. So this is how our enrollees on standard JARA can access the telemedicine service, either via our health hotline, via the ILERA EKO telemed app, or either the virtual booths. So you can see we've created a market for everybody, easy access for everybody.
So whatever your choice,
so if you have 3G network, you can use the health hotline. If you have good network, you can still use the ILERA EKO telemed app. And if you don't have any digital devices, you can approach a virtual booth.
Okay. Now, so for the telemedicine plan, I know there are times when the doctor has to do some sort of examination. How will this work?
Now, that's why we have the V-boots.
Okay.
Now, the V-boots are created in such a way and manner that you have some persons that we have the nurses that are manned by nurses.
Okay.
So we have the nurses that would, perform necessary tasks on behalf of the doctor remotely.
Okay.
So you pass across the instructions and they'll perform the necessary tasks on behalf of the doctor remotely. And also, I would like to point out here that the virtual booths are complementary services. They are not for emergencies. They're just to access, basic complaints.
And they are not hospitals.
They are not hospitals. They're just complementary services to serve as registration points for our standard JARA plan and to access non-emergency medical care.
Emphasis on non-emergency.
Non-emergency medical care.
Okay, so an instance where someone, say, collapses at the hospital, at the market, what happens?
So at the V-Booth, we can offer basic resuscitative services before transfer or referral to our provider facilities for continuation of care.
Okay.
And the standard JARA covers you for that admission and then the hospital in case of emergency.
Okay, that's
any
for those
facility
who are already on the plan.
standard JARA, yes.
Okay, for sake of emphasis, what types of medical issues can residents consult with doctors through the ILERA EKO telemedicine service?
Okay, so we have the part of health education, health
inquiries, okay.
Yeah, mental wellness, health tips, then basic complaints like treatment of fever, cough, headache. Yes, and drug refill, medication refills for our patients that are on chronic medications.
Okay, so maybe someone who needs to refill maybe
antihypertensive. Yes, you can approach the booths. Yes, you can access care.
Okay. So now for the market women, not everybody is fluent in speaking English language. So how will this work?
Now it's interesting because this service offerings comes in multiple languages.
Okay.
We have in Pidgin, we have in English, we have in Igbo, we have in Hausa, we have in Yoruba, and very soon we'll have in Ego.
Okay.
Yeah, so it caters for you. If you don't understand English, we have translators that will help speak the pidgin, both doctors as well as
Even
nurses.
at the
Yes,
V-boot?
yes, even at the V-boots. So the languages English, Yoruba, Igbo, Hausa.
Okay. So for someone who registers on the standard JARA plan with the entire family, will the whole family have access to this telemedicine service?
Yes, they would.
Oh, great.
Yes,
great.
they would.
Okay, so now talking about drugs, you already mentioned that you can get your drug refill. If, for example, I use the telemedicine service and say the doctor prescribes drugs for me, and for example, for one reason or the other, the drugs are not available at the V-booth, what happens?
So we have an integrated system for drugs. So we have a particular software used by our provider facilities. That facility is registered under the Lashma scheme. So you can pick up your drugs at any facility.
At any facility. Okay, so I can actually get the prescription from the V-boot and then go to any of the prescribed pharmacies?
Yes, around.
Okay.
The pharmacies, provider pharmacies.
Okay. So in a situation where the emergency case, there's an emergency where it happens. So can we also handle that? Speak with the doctor in a V-boot, and then before moving to.
Now, with emergencies, an emergency is an emergency. It's treated at the accident and emergency.
So
the hospital.
It's not under the purview of the V-boot.
Not under the purview of the V-boot.
Oh, great.
It's just for non-emergencies.
Okay. Yes. Okay, so let's just, for emphasis, for reasons of emphasis, let's just have the locations of the V-boot.
Okay.
So, the 5 V-boots at this time.
So we have in K2 markets.
Yes.
We have in Sabo Yaba markets.
Okay.
We have in Sabo Ikorodu markets.
Okay.
We have in Adamo Ikorodu markets.
All right.
Then Ayetoro markets in Ekwe.
Okay. Now, taking you back to the standard JARA plan, that is the latest offering, and we have to, sensitize Lagosians. I know a few people who perhaps didn't tune in last week. Standard JARA plan, what are the new benefits? What are the benefits? Why is it JARA? And let's talk about the pricing. Can we do that?
Okay. So for the standard JARA, for the individual pricing is now 15,000.
15,000 as against
per annum, as against the 8.5 we used to have for the standard
plan. Okay.
And we also have the offerings to be able to pay either on a monthly basis.
Pay small.
Yeah, pay small.
Okay.
On a weekly basis or quarterly basis or biannual.
Okay.
So on a weekly basis, we're having it at 400 naira per week.
400. Okay.
On a monthly basis, we're having it at 1.5.
400 per week.
Yes.
That's interesting. I'm hearing this for the first time.
400 per week. So that's you see, this is the basic health social insurance plan. So it's accessibility for all, affordability for all.
That's amazing. 400 per week.
You can recharge your phone with that.
Yes, it's more than that. Okay.
So we have it at 1.5 monthly.
Okay.
We have it at 4,125 quarterly
for
the individual plan. Biannual 8,000 naira, and the annual plan is 15,000
naira.
Yes.
Let's say if it's just you.
Yes.
Okay, moving ahead to the family.
So we have the family of 4.
Okay.
So for the family of 4, we have monthly at 5,400.
Okay.
We have the quarterly at 15,000.
Okay.
The biannual at 29,250. Then the annual at 55,000 naira. That's for family of 4.
Okay.
Then for family of 6, we have monthly at 8,000 naira.
Okay.
We have the quarterly at 22,000 naira. We have the biannual at 42,500, and we have the annual at 80,000 for family of 6. Now that family of 6 is the principal and the spouse with children under 23 years.
Okay.
So for 4 is principal and spouse with 2 children under 23 years.
Okay. Now, so I'm curious. Why did that cut on me? Why 6? Why 4? What happened?
Well, we're in Africa, so we have large family sizes.
But prior to this time, it would just be father, mother, and
2 children.
Yes. So no, we had for the family plan. So why is there now like a provision for those who have a family of 6 and those who have family of say 4? Why that?
So we added more coverage, to increase the scope like to add more people, a family of 6 for families.
Okay.
Because traditionally African families.
So it wasn't that people came to complain.
There was that, yes. So that was the feedback. That was a request from enrollees. So that was the feedback.
That they wanted
more. The Jara is in it.
From what I see, standard Jara basically is a combination of feedback.
Yes, it
what
is.
People want, the best of all the different, and all
so
that.
it shows we've been listening to our enrollees. We've been listening to their complaints, their requests, and their feedback.
Interesting. Quickly take us through the registration process. How does that work?
Now, for the registration on the standard Jara, you can register at the V-Boots, where the nurses and front desk officers will take your details and register you on a plan policy ID. If you generate your policy ID, and it starts from there. Then you can also register via our website. You can also register via USSD.
The website
www.lashma.com.
www.lashma.com. And USSD, what's the USSD code? Do we have that? All right, let's
star 6700
star 6700
star 006 hash.
Okay, so we'll take that again, but slower because of those who want star 6700
star 6700 star 006 hash.
Okay, so anybody who types this USSD can actually register via
purchase
a plan.
Yes.
That's the standard Jara plan.
Jara.
Okay, so if I use this USSD, can I also pay via the USSD? Is that possible?
It will generate you a link. You can
go do my payment and all that. Okay,
that's even from our hotline, our sales hotline.
Okay, let's just have that one more time.
The sales hotline.
Yes.
We have the 0700 ILERA EKO.
0700 ILERA EKO. That is
0700 463 723 56.
Okay.
0700 ILERA EKO.
All right. Okay, so Dr. Aturashe, before I let you go, what is your final advice to Lagos residents concerning the ILERA EKO Standard Jara and Vibu telemedicine service?
Okay, my final word to Lagos residents is the Standard Jara was created for you. Please would appreciate maximum utilization. It's based on the feedback from our enrollees for Lagos residents. And now, we're selling inclusivity for everybody, affordability for everybody. You don't have to be frustrated out of pocket payments to access health. Now we're creating an inclusive plan for you, an affordable plan for you, and making health equity, attaining universal health coverage for all. That's our goal. So come in with Lashma and enjoy the services we offer.
A great one. Thank you so much, Dr. Abiodun Atunrashe, Digital Health Manager, Lashma, for taking time out of your busy schedule to come help us shed light on this very, very interesting and important topic for Lagos residents to gain from. Dear listener, we have come to the end of the show. It's been a very, very eye-opening time. That no one should fall sick without having access to quality healthcare at very reasonable prices, why we always bring you the show every Monday at 10:15. And we are doing our best to make sure that is attainable. Okay, a big shout out to Halima right here in the studio with us. Also a big thank you to Victor Oteri. And also thank you very much to Adein Kagbemigbade. She came into the studio with us today. PAO Lashma, Public Affairs Officer Lashma. You're so great having you with us. And dear listener, the show will make a return same time next week. Thank you for tuning in. Do not forget that we appreciate your feedback. Keep them coming. You can go back to our Facebook page to have a rewatch of this show at your own convenience. Simply search for ILERA EKO Extra. Our Facebook page is Lagos Traffic Radio 96.1 FM. Our YouTube, Traffic Radio 961. Till we come your way again next week. Remember, health is indeed wealth. And